Ivan Bukenya Sanda from Ivan's Medical and Research Consults. I will be taking you through midwifery, abnormal midwifery, and I'll be reading a question as I provide the answers. So question 1 is states the classification of uterine rupture, and 2 is outline the importance or the roles of a midwife in preventing obstructed labor. So these are the answers. Question 1, I said the classification of uterine rupture is categorized into 3. Number 1, complete rupture. Number 2, incomplete rupture. Number 3, the dehiscence, as written in this book. So complete rupture, this is where all membranes, all muscles underlying the uterus have ruptured. That's complete rupture. Secondly, incomplete rupture, that's where this is partial. Part of the uterus has ruptured, but the serosa part has been spared. That is incomplete. Then that is complete rupture. Then we have what called the dehiscence. This is a separation, mere separation of a scar from a previous uterine surgery. So someone who had a previous uterine surgery, if the scar separates, then we call that one a dehiscence. So those are the 3 categories: incomplete, complete, and dehiscence. Question 2 was asking us the roles, outlining the roles of a midwife in preventing obstructed labor. Point 1 is early detection of abnormal labor patterns. So you should be able to identify early the abnormal patterns of labor. Secondly, monitor for cephalopelvic disproportion. That means there is a high risk, a high degree, yes, of obstructed labor. So make sure you monitor for it. Then ensure timely referrals to higher facilities. You may be working at health center for, if there is a nearby general hospital, refer that mother as early as immediately. If you are working at a general hospital, refer that mother on a regional referral or regional referral to national referral before the problem escalates. Then point 4, educate mothers on the importance of antenatal care. Remember, antenatal care, that's where we are able to identify risky mothers and prepare ahead of time in case there might be a risk for such and more other complications of labor and pregnancy. So if you educate the mothers about the importance of regular and timely and routine antenatal care visits, it is really important. Then point 5 is administer oxytocin cautiously to avoid hyperstimulation. Oxytocin is an inducer of labor. So it allows for stimulation of contractions, but it should be administered cautiously. You must be cautious while administering it in order to avoid hyperstimulation, which can actually exaggerate, hence bringing to uterine rupture and rupture of other membranes. It can even lead to tears. Then lastly, regularly assess fetal heart rate and progress of labor. Fetal heart rate, this will help you avoiding the conducting a delivery for already dead inborn. You know, we have a call intrauterine fetal death. You deliver when someone has already died, the baby has already died. Monitor, assess fetal heart rate regularly and the progress of labor using a pathograph. I hope you know, making it a pathogram by filling in it. It's very, very important. This information and more has been brought to you by Ivan's Medical and Research Consults. We have all question banks, question and answer booklets for nurses and midwives at a fee of 25,000 each. For more information, 05